Why are you so interested in disability?
Well, I suppose I've been touched in my family by it very personally from a very early age. So my older brother, Tommy, had measles and encephalitis probably at about 2 years of age. So he had a severe intellectual disability and cognitive problems, behavior problems. But we grew up with that, but it was in America where I grew up. And it was a sort of a time where there were no services for people with disabilities at that point, really. There was really nothing, and there was a blaming. So there was, so my parents, I saw my parents taking him to specialist to specialist to specialist, and they got all of these things. So there was, there was a time when they thought that autism was related to a refrigerator mother. So you had all of these stigmas to overcome and things like that at that time, a complete lack of services. So my father and my mother, my father was a doctor, my mother was a medical social worker, so they actually set up all these community services for my brother, which was fantastic, and involved us as the kids involved in that as volunteers. So, from early childhood, I was volunteering, doing different sporting activities, and then I did things like the Special Olympics, and then before medical school, I was a special education teacher. So that was a real great opportunity. So when I grew up, disability was a normal part of life. Growing up, and not only my brother, but all my brother's friends were my friends, and so it was a normal part of my own upbringing. So and then since I've also had lots of other family members who've had strokes, who've had epilepsy, who have had Down syndrome, lots of other conditions, and so I think when people are touched by it personally, it takes on a different meaning. So I went from special education then and then did a psychology degree, and then did a medical degree, and then trained as a neurologist, then trained as a psychiatrist, and then trained as an epileptologist. So I like training.
So you're a tologist.
I'm a tologist, that's right. So I'd still keep training if I could. I just love learning all about the brain, as you do, I know, because, but apparently there's things like mortgages and school fees that you have to pay. So
there's a few things that get in the way.
A few things that get in the way, that's right.
Thanks, Harry, that's wonderful. So can we talk about the general effects of brain injury from a stroke or traumatic injury? Could we get some idea about that?
Yeah, well, I mean, whether the brain injury is a stroke or a traumatic brain injury, or in the case of my brother, an infectious injury, you oftentimes have very similar results, and it depends on the nature of the injury, how fast that injury comes on. It depends on the part of the brain that is affected, and it depends very much on the resilience of that individual and the environment that they're in. So it's a very individual type of response that everybody has. So if it involves a part of the brain, for example, that has to do with emotion and memory, which it frequently does, that's the limbic system, then you can get a wide variety of responses, including anxiety, depression, memory problems as part of the sequelae of brain injury. So that's the most common things that I see. Sometimes I will see people who have seizures that occur as a result of a brain injury. So when you have injury to the brain, sometimes what happens is that brain heals, and as a result you get a scar in the brain, essentially, where it heals, and that can form as a sort of focus later on, which can be months or even years later, as a seizure focus. So people can then get seizures as a result of that.
Okay, very good. I guess we should talk about the first, often, as I said in my talk just now, those first few months after you've left hospital or rehab or whatever medical service it is, and you're home, they're difficult months, aren't they? Right. What sort of advice might you give, general advice about that early period?
Well, those are really difficult times for many people, and the key thing there is to engage. I think that is the most important thing, because it's an important part for the repair of your brain, and we'll talk a bit more about neuroplasticity coming up, I'm sure, but the brain is able to repair itself after injuries. And those months right afterwards are actually quite critical to that repair time. There's a window of opportunity where that type of repair in many parts of the brain occurs much more easily and readily in those first few months than it does years later. It can occur at any age. You can get brain repair occurring, many years after an injury, which is very heartening. But that critical period is a part that you really want to engage with your environment, engage with your loved ones, with the people who are looking after you as well, and really focus on wellness and focus on, as you say, appreciating the interactions and the loved ones around you is a very important thing. And that's so critical, I think, for the carers and for the families of people with disabilities to try to instill hope, because that's the time when you feel least hopeful, unfortunately, for many people. You go home and you think, oh my God, what has just happened? What does the rest of my life have for me? And it's very easy to get into a sense of thinking of catastrophizing. So to have a series of sort of negative thoughts bring you down in a spiral, and to think, oh my God, now that this has happened, I can't do that, I can't do that, I can't do that, I can never do this, and oh my God, you think the worst. And that's how depression happens. That's how it's that sort of catastrophizing of thoughts, of negative spirals of thinking. So you can't let that happen. And having good people around you that care is really, really important, and engaging with them.
Yeah, and I seem to remember that having people around and engaging with them, as you say, becomes a circuit breaker for that catastrophe, that sort of negative spiral and thinking.
Yeah, that's a good
so
term.
They help become a circuit breaker.
Yeah. So, and I think oftentimes even it's difficult for the families and the carers as well, because they often feel just as or even more overwhelmed than the individual. But what you've got to do as well is find that inner strength inside you and try to pull it together and be there for your loved one.
And I think the other bit of advice, if I was going to go from my own experience, is just this idea of doing one day at a time. When you're so overwhelmed by everything, you think, well, what's the good things I can do today? And then the next day, ask yourself the same question. And have I done all the things I can think that might be good for me today? Yes, I have. Okay, you've had a good day.
No, that's a good.
So
that's
breaking
good advice,
things down really bite-sized pieces.
Yeah.
All right, I think we need to talk about neuroplasticity. You and I both love that topic, but perhaps we should talk about what it is and how we can start to use it to our advantage.
Okay, Well, neuroplasticity is something that people have known about for many years, but in sort of mainstream neurology and psychiatry and medicine, it's been only the last sort of really 10 years or so that it has been accepted. So when I trained as a doctor in medical school, when I trained as a neurologist, when I trained as a psychiatrist, during all that training, there was the dogma that you had injury to your brain regardless of what that injury was, psychological, infectious, traumatic, whatever, that there was damage done to the brain and that was it. You couldn't repair those neurons, you just had to get on, and it was all about acceptance. But we know now that that's complete rubbish, and we know now that the brain can actually repair itself, the brain can do amazing things. And now other disciplines had accepted that, but your own discipline had accepted that long before my discipline. So, because I trained in psychology before, and actually I trained under, one of my professors was Donald Hebb, who was one of really the very famous founder of the principles of neuroplasticity. And so psychologists had actually accepted that long before doctors, neurologists, or psychiatrists. And now it's an accepted fact. And I think it's quite important because it's, to me, this is the most exciting discovery in neurology and psychiatry and in brain injury, and because it unleashes a whole new plethora of different treatments that we can't even begin to appreciate now fully.
Yeah, I mean, the potential is huge, isn't it?
The potential is huge. I think you saw that for yourself when I had the privilege of meeting you along your journey, as you mentioned, and you saw that for yourself, and I saw that you actually engaged in that right early on, you
Yeah.
started saying, I need to repair my own
Yeah.
brain here, and
Yeah.
and you took control, which I thought was
Yeah.
a fantastic thing.
Yeah,
Showed
and because of my
tremendous insight.
psychology training, I knew how neurons worked, and I knew that I just had to activate networks in particular areas to get things working again.
Yeah.
Could we just touch on what exactly is happening in neuroplasticity change? What, you know, at a neuron level or a brain
Okay,
level?
yeah.
Because I'm not sure that everyone understands that.
So the most common way that you have neuroplasticity happening is that you actually have neurons that find new pathways in the brain. So you may still have, if you do an MRI, you may still see the same damage. You don't necessarily see structural changes occurring that will be picked up on MRI. What you see is actually much more important than the structural changes. What happens is functional changes. So you get new pathways in the brain. So it's sort of like if you're driving, so I commute quite regularly to Brisbane, and if you're driving on the M1 and there's a big traffic delay at Springwood, you can turn off the highway, you can turn on your GPS, and you can find a new pathway to get to Brisbane and still make it to your meeting on time. So you're going off the beaten path, you're going a different way, but you're still arriving at the same place to do the same thing. And that's what neuroplasticity is. It's finding new connections. So a good example, I think, is when you have, for example, when you have a stroke, for example, or a traumatic brain injury that causes a weakness in one arm, okay? So that would be a damage to the motor cortex in one side of your brain. So if that's in your left side of your brain, that'll be your right part of your arm that is affected there, okay? So if you then get weakness in that right arm, and rather than what the traditional rehabilitation would be, well, let's learn to use your left arm. Okay, you're right-handed, let's learn how to write with your left hand and do all these things with your left hand. But if you do that, then you don't get any additional function from your right arm. If, however, you take that left arm and you tie it behind your back, and you actually force yourself to work with your right hand and learn those things with your right hand, there's 90% of the pathways in the brain go from your one side to the other for movement, okay? So you've got about 90% of your pathways, and those are the ones we generally use in normal day-to-day living. The pathways that go from the left side of the brain to your right side, and that's how we get on. But you've got another 10% of the pathways that exist that in normal life we rarely use, but they're like a spare, and they actually go from the right side of the brain, which in this instance, in this example, would be the healthy brain in such an individual, to the right side of the brain, to the right arm. So if you exercise those pathways, then that actually, you can actually end up getting back function in your right arm. And you're just using a different part of the brain and different pathways to achieve the same thing. And you're taking your good arm and you're tying it behind your back so that you're actually forced to use your right arm. So a lot of it is about practice. And this is what the professor I had at McGill when I was doing psychology, Donald Hebb, he was famous for this expression, neurons that fire together, wire together. And that is about practice, practice, practice. The more you do practice of any type of activity, the more that is reinforced, and the more those connections become the dominant connections.
And could you briefly touch on the time frame we're talking about? What sort of time? And I mean, it depends on how much practice you're doing.
Yeah.
If you're practicing every day, but what sort of time frames are we looking at for sort of good solid change?
Well, it's as long or as short as a piece of string is the short answer, I suppose. So I mean, for some types of injuries, that time frame can literally be weeks. For other things, it's months. That would be more usual type of recovery period, but it can be years even. Yeah, good. Okay, thanks.
So let's talk about the sorts of things that get the brain working well again. And this is my experience and some of the research that I'm familiar with as well. We do all the sorts of things that are generally good for making us healthy. So adequate sleep, exercise, nutrition, social interaction. Can you comment on these types of things and how they help heal the brain?
Yeah, those are so important. And I think so underemphasized, particularly in sort of modern day medical practice. People don't seem to emphasize things like nutrition and exercise and a more holistic approach, which is a real shame, because there is a really strong evidence base that many of these things work. Exercise, for example, is very good, not just obviously for your cardiovascular health, for your power, for returning your strength to any weakness that you might have from an injury, but it's also very good evidence base for exercise in the use of treating depression, for example. Very powerful treatment for depression, and I think grossly underutilized. Partially because when you're depressed, whether it's from a brain injury or for any reason, the last thing you feel like doing is exercising. But the reality is the last thing that anybody feels like doing is exercising. But once anybody actually gets out there and starts doing it, then it actually starts to feel good. And the more you do it, the more it feels good, and that gets back to this, neurons that fire together, wire together concept of practice, practice, practice. And so these are very, very important things for recovery from any type of brain injury.
And any particular advice on nutrition?
Well, I think it's difficult to. I think it's important not to get to believe all the hype that's out there about take this vitamin or this nutrient and that's going to be good for your brain, because the evidence base for particular vitamins or particular things that you might buy from a health food store as nutrients for the brain is actually quite low. What's more important is to have a good, healthy nutrition. So if you actually are eating a well-balanced, healthy foods, non-processed foods, this is actually much more important than any specific nutrient. So you'll see lots of nutrients that you buy these things in the health food store that says brain vitamins or that sort of thing, and that really is more marketing than science, it should be said.
And I guess the other thing we might just touch on a bit more is the social interaction, which you mentioned is important those first few months when you get home. But social interaction is helping to stimulate neuronal pathways, isn't it?
It is, absolutely.
As well as being good for mood. So it's actually a form of neuroplasticity.
It is.
Yeah.
It's an excellent way of healing, yeah.
And the difficulty for those that are brain injured is that they feel like isolating, withdrawing and reducing the amount of stimulation. But we've got to actually go a little bit beyond perhaps what we feel at the moment that we want to do. Yeah.
No, I think that is very important. Yeah.
Okay, and let's move on to very specific things you might do if you've got particular deficits following brain injury. So there's the whole lot of brain training programs. There's doing novelty things, learning a new language, learning new things is important, it seems to be. Meditation, for example, light therapy. Can we touch on some of the strategies for specific brain repair?
Right. Yeah. Well, I'm a fan of the different types of brain training. I have to say, I think they're good for everyone, not just if you've had a brain injury. I think now, unfortunately, the sort of marketing and the science get mixed up there, so it's difficult to know what to believe with which is the best program. And I think the best program is the one that you use. Is the bottom line. I think if you try the different programs that are out there, and there's lots of different online programs that you can try, and if there's one that particularly you find that you can use on a daily basis, that's the one to go for. I recently signed up our whole family for one of the programs online, and I'm really pleased to see that my boys have actually taken to it, and they're doing it every day, which is great. So
they might end up being smarter than you.
Wow, I think they already are. I think though the thing there is that what you want to be doing is you want to train specific deficits. So you don't want to just go to your strengths. You want to be looking at where your weaknesses are and working on them. And some of them actually are geared to do exactly that. That they measure what your weaknesses are at the beginning, and they say, okay, memory is a weakness, let's train that. So or facial recognition is a weakness, let's train that. And so you can actually go and train in your specific areas that you need to do. And I think that's important, and just training and retraining and learning tricks for your brain to be able to remember things, those things work. They actually do. So that's one thing. Now, in terms of things like meditation, Well, meditation is also a great way forward. Meditation and Tai Chi. You know, in the East, people have been using these techniques for thousands of years very successfully, both in the context of brain injury, but also in the context of normal life. They are healthy ways of really maximizing the potential of your brain. Now, in the West, you know, for some reason, we're not allowed to talk about, you know, energies and cheese and that sort of thing in the West. So we have to come up with new ways to explain this and talk about neurotransmitters and serotonin or whatever. But the bottom line is, so we have to invent a whole new word. So we call it mindfulness here. And mindfulness is really, you know, it's a new term. It's the new black in psychology in Western countries. But it's exactly what they've been doing for thousands of years very successfully in the East. We just, you know, use words like neuroplasticity and neurotransmitters to explain it, give it a new term. Suddenly it's okay and you can bill for it on Medicare. So. But it does work is the bottom line. You can believe in cheese and energy flows, or you can believe in neurotransmitters. Those are just different religions in a sense in terms of why you use it.
And are there particular activities that seem to help get the brain working? And so for me, music making seemed to help.
Yeah. Oh.
You know, and dancing, learning a new language, which can be good for everyone, of course.
Absolutely. Yeah. I think those are fantastic activities. I think music therapy is a grossly underutilized one, and there are some good studies to show that it does work in brain injury, and certainly I have seen some dramatic recoveries from some patients using music as therapy, because music is very, very powerful, and dance integrates with that beautifully as well, of course. And then there's things like cognitive behavioral therapy. So you'll know a fair bit about this as a psychologist. This is the new black in psychology is cognitive behavioral therapy, and it's the new black because there's lots of evidence and studies that shows that it actually does work, which is fantastic. Previously, for all your longer-term psychotherapies, your psychodynamic psychotherapies, the studies weren't there because the studies are too difficult to do. It takes too long to do them. They're too expensive to do. But here, with cognitive behavioral therapy, it's a simple therapy, and it's just about changing the way you think about your health and your illness. That's simple. Not easy, but very simple. So I'd like to give an example of how that works. When I was a 5-year-old, I was out in the woods playing army with friends of mine. And I didn't, I don't know why I was playing army. I was raised Quaker, so I didn't, but that's another story. But one of my friends stood up and said, you know, we're going to play army. I'm going to be the general. Another friend stood up and said, I'm going to be a 4-star general. And he pointed to me and he said, and you're the cook. I was just devastated. I just broke out instantly into tears. I ran straight home. My father saw me run in the house. I told him what happened. He said, oh my God, they made you the cook. How good is that? I was in the big one, WW2. You do not want to muck with the cook.
An army marches on the food.
That's exactly right. That's exactly right. So I felt like a bit like Steven Seagal in The Siege. Any of you seen that? You know, he saves the world as the chef on the boat. So I marched right back out to my friends and I said, "Look, I just talked to my dad. He beat Hitler. He saved the entire planet. He says the cook is the go. So you, General, over there. You, Sergeant, over there." And they listened. They listened. They listened to me. The game was the same. The players were the same. Suddenly, though, everything changed. And the only thing that changed was my attitude, was what I was thinking. And that was really cognitive behavioral therapy that my father had done on me without even him realizing it at the time. But it worked. And that is a powerful way of thinking about it, because it's really about just changing the way you think about the situation.
Yes, and I was talking earlier about seeing disability not as a total negative, but as a new beginning.
Yes.
And that's attitudinal change, but it can take quite a long time to get there to really believe it.
It does.
Yeah.
It does. Absolutely. And that's why it is good to engage with somebody, to find a good psychologist. I think are much better at this than any other profession. A good psychologist that you can engage with that can help you to get there more quickly. Because it does take assistance. It's not, as I say, it's a very simple concept, but it's not easy. So you need assistance. So if you can engage with a psychologist for cognitive behavioral therapy, I think it's a very powerful force for recovery.
And I think the other thing which is very validating is that things like cognitive behavioral therapy, meditation, mindfulness, when people practice those, and they might only do it for an 8-week block, it shows brain changes, actual physical brain changes.
It does, yeah.
So it's not just something mystical that you just have to believe in. It's causing actual change in the brain.
It does. It causes actual change in the brain. You can measure that lots of different ways, but they are very powerful. And whether or not you want to believe that it's working because of the brain changes, because of changes in neuroplasticity or neurotransmitters, or whether you want to believe in that it's, I think it's probably more common belief in the Byron Bay area here to think about chi and energy flows, but whatever works for you, it does work, is the bottom line.
Well, the important thing is we've got good coffee here.
We do, this is great. And my wife just brought this to me just in the nick of time, yes.
Let's move on to some of the specific things that happen with brain injury that, of course, is often a problem for us. And one of those is sensory changes. So I noticed, for example, that I lost some of my sense of taste and smell post-injury. It wasn't a big problem, but I was just less interested in trying different foods because they didn't taste that different. Can we talk about sensory changes, temperature changes in the body, for example?
Okay, So there's lots of different sensory changes that can happen. You can have sensory changes to your smell, sensory changes to your taste. These are very, very common. And also equally common is sensory changes to your skin. So you may get loss of sensation in different areas of your skin. Now these recover remarkably slowly compared to other aspects of brain injury, it should be said. And there are different tricks. So it is worthwhile working with somebody with in the instance of smell and taste, to work with an ENT specialist and or a psychologist to try to bring these things back quicker. But they do come back very, very slowly, and part of that is changing the way you think about it, as much as focusing on the actual recovery of the symptoms.
Maybe practices to do with challenging yourself in those areas as well.
Challenging yourself in those areas is good. So trying new foods anyway, even though you don't know if you'll be able to taste them, trying new foods, trying jalapenos, trying different types of Asian spices, trying whatever it is. Did you experiment with different foods, or how did you deal with it?
No, I didn't follow good advice in this case. So I tended to avoid any foods that I wasn't interested in. And it's only been in more recent times that I've wanted to eat hot foods again, like chili hot.
Oh, is that right?
Yeah,
okay.
and I like it now, but I
And
just
you like
lost all interest in that sort of thing.
Okay, and do you get has your flavour come back with that? As your
I think it has. It's much better than it was. Yeah. Let's move on to fatigue, mental fatigue. I mean, there's physical fatigue following brain injury. I remember feeling very weak physically, and just walking on the flat surface was a real effort. But what I've noticed, and I know many people with brain injury notice, is the mental fatigue.
Right.
Can we talk about what fatigue is and how common it is?
Well, it's very, very, very common. And now the important thing to remember is that fatigue is a symptom. It's not a diagnosis. And I think that's quite important. So it's important to look at to see if there's any underlying, easily treatable causes of fatigue. So for example, sometimes people's diet can change, or their absorption of nutrients can change. So it's good to ask your doctor to screen for different vitamins such as folate and B12, because people can become deficient in them after an injury, and that can cause fatigue. Also, after a brain injury, you can get a wide variety of different hormonal changes. Now, so it's good also to do some hormone screens for a number of different hormones, but particularly the thyroid. Because if you have either an overactive or more commonly an underactive thyroid that would occurring, then that can actually cause extreme fatigue. And you don't want to miss that because, again, highly treatable. Highly treatable. Similarly, very easy to check the blood for things like anemia to make sure you don't have iron deficiency or another type of anemia that could be, again, another easily treatable cause of fatigue. Now, so that's my first approach, is looking at excluding common treatable causes of fatigue.
And would sleep difficulties fit in there?
Sleep difficulty is huge, yeah. I'm pleased you brought that up. So I'll frequently get overnight sleep tests, polysomnography, to look at people's sleep patterns, because it's very rare to see somebody, it's very rare to see somebody not just after a brain injury, but to see somebody in general that doesn't complain of sleep problems. It's a really common problem, and a really easily treatable problem. So sometimes, for example, you can have structural changes that can occur, or changes that make it so that your breathing will change at night. And so sometimes that we see either as a result of a brain injury, or independently, people can get something called sleep apnea. So they actually will stop breathing for different periods of time during their sleep. It's an extremely common condition, but really important to pick up and diagnose, because again, highly treatable. And then people can present, if they have sleep apnea, with extreme just mental fatigue, physical fatigue, depression. I've even seen people present with conditions that look like Alzheimer's disease, where they're really cognitively impaired as a result of that. But then you treat the sleep apnea and it goes away. It actually goes away. So it does, it's a very high, people don't like the treatment because you have to breathe, sleep with an oxygen mask is what it amounts to. A lot of people don't enjoy it. But once you get used to it, if you can find a device that is comfortable for you, it's a highly successful type of treatment.
Yeah. Okay, so we've excluded all those independent sources of fatigue.
Yeah. Now
we're dealing with the fatigue that comes with brain injury. What can you tell us about that?
Well, that's more difficult, but unfortunately very, very common. Diet and exercise are very critical there, and particularly the exercise component of that can help with fatigue. The blue light therapy, I think you're going to interview a few people who've tried the blue light therapy, and that's something that we've recently started using in the clinic, and there's no question that we do see patients who seem to benefit remarkably from it. Now, I should emphasize that the evidence base for this is fairly low. There are studies that show that it is effective. Why it works, how it works, and how well it works, and the dose that you need, there's a lot of unanswered questions still. But I suppose I have no problem recommending it to patients because it's not something that's likely to cause harm, is the bottom line. So, if it's worthwhile giving it a try, you can actually just there's free apps that you can download for your iPad, for example, that are blue light apps that you can try the blue light therapy, essentially for free. If you have a smartphone or an iPad or a similar device, an Android device, you can download free apps to give it a try at no cost. So there's ways to do it where there's no physical adverse effects from it that certainly that I've heard of or that are known. So it's a very safe type of procedure to do, but also if you don't have to invest hundreds of dollars into specialized equipment, and you can use your own existing equipment for that, it's actually not very costly either. So I think that has a role, and I think I'm much keener to try something like that with a patient that doesn't do any harm before going to different medications. So medications can have there's traditional stimulants for your amphetamine type of medications, and I'm very reluctant to use those in that because they do have longer term side effects, and they do have addiction potential. There's other drugs, other types of stimulants that are less problematic from an addiction standpoint, such as modafinil, but unfortunately the evidence base is not great for them to use for using those in traumatic brain injury. So they can be used, but it's an off-label use of those medications.
So I think what you're saying, and it's my experience as well, is that largely what we're doing with fatigue is managing it the best way we can, learning what causes it, what helps overcome the fatigue. And my own experience was, and I've only had this validated recently, where one of the people in the audience spoke to a neurologist in Melbourne recently who specialises in strokes, was that I had to learn what my limit was with doing certain activities or being in certain environments, like a noisy room with lots of people talking, or I couldn't stay out late, for example. But every now and then I would test how I'm going with that. So when I felt I was a bit stronger, I would reintroduce myself into that type of environment. And at the beginning of this year, I went to a music festival for the first time in years, post-stroke. And what happened was, I found that I could stay up late, I could listen to amplified music, And the next day I could still function.
Great.
And so what that's done is it's opened up this new life where I can actually go out late.
Yeah.
I can go back to dancing and listening to live music.
Fantastic.
But, you know, I'll still crash if I keep doing it. I can't do 2 nights in a row.
Right.
But for a long time, I was afraid of all those environments.
Okay, all right.
So interestingly, this neurologist told one of the members in the audience today that you still need to test your fatigue limit a little bit every now and then.
I think that's a very good advice.
And that's the way to start to get some advance.
I think that's very, very good advice, yeah.
All right, well let's, do we want to comment on depression a bit more? We've talked about cognitive behaviour therapy and mood changes, but...
Sure, yeah, well depression is also very, very common. I think again you've got to look at the underlying cause of depression. So sometimes it can be a direct result of the brain injury itself. But I also like to look and make sure there's no problems with vitamin deficiencies or thyroid disorders, because those are also very common causes of depression as well, and very treatable. So you don't want to miss a physical cause for the depression. The other thing is looking at the effects of medications. So sometimes depression can occur as a side effect of different medications that somebody might use post-brain injury. So different types, there are some anti-epileptic drugs that can cause depression. There are some drugs used for pain and different narcotics that can cause depression. And so you want to take a broad look at what's going on with the individual, with their health, and not just assume that it's depression as a separate entity. You want to look for underlying causes that are treatable. So if that's the situation, then you can always find anti-epileptics that do not cause depression and try those instead. You can always find pain treatment that do not cause depression and try those instead. So those are much better treatments for depression, is to try to look at underlying causes. The cognitive behavioral therapy is really fantastic, and it really does work. And it is something that is at least as, if not more effective than medication for mild to moderate depression. And most international guidelines will recommend using cognitive behavioral therapy before using a treatment for depression, medication treatment for depression. But the medications do also work in depression that is related to brain injury. So there's different choices. The ones that are most commonly, that are considered first line, would be what's called the SSRIs. So these are your drugs that are related to Prozac. So when Prozac came out, it was the greatest thing since sliced bread. And so you had all the other drug companies that saw how well Prozac was doing, and they all put up their hands and said, said, me too, I want to make $1 gazillion as well. No, they didn't. They put up their hands and they said, I want to help people with depression too, because I have compassion. So they all
warm-hearted.
They were very, very warm-hearted drug companies. And so they took Prozac and they took it back into their own labs and reverse engineered it, because of course Prozac was on patent, so you can't just steal another drug company's drug. So with that, and that's the basis of most of the antidepressants that we have today, really, is sort of different derivatives of Prozac. And one may work for one individual and another may work for another individual, and you can't predict which drug is going to work for someone. So and that's problematic, because it works about, you've got about 2/3 of people responding to the first drug that they're tried on, but that means about 1/3 of people don't respond. So you've got to persist and keep trying different medications, try different classes. There are lots more drugs besides just your Prozac-related drugs available now as well.
And I guess I would like to emphasise that depression, or feeling, I talk about that period immediately post-stroke, and that 18 months to 2 years is the dark ages.
Yeah.
And I guess what I would want to emphasise is that in a way, depression or mood changes are sort of normal. If you had a big life shock and you've got to reorientate your life,
yeah,
of course you're going to feel out of sorts and maybe quite depressed. So in some ways I would normalise that experience, and so there's nothing wrong with me. I'm actually having a normal reaction to something really unusual, but at the same time, we've got to engage with other people. We've got to keep safe.
Yeah.
Because suicidal thoughts can be very strong at that time.
Suicidal thoughts can be very strong, and that's why I think it is very, very important that people do, that you have somebody who you can voice those thoughts to, because you need to have a psychiatrist, a psychologist, a family member that you can voice those thoughts to, and somebody to keep you safe. Somebody to keep you safe, because that is very, very, very important to get over and get past those thoughts, because those thoughts will pass, and you've got to get past them and know that it is going to get better.
Yeah. Let's finish up now with questions or issues to do for carers.
Okay.
Because one of the things that I discovered when I was doing my own personal research was that the way we pick up other people's emotions and what they're feeling is that we have in our body, which includes the nervous system, which of course extends through the whole body, not just in the brain, is that we resonate with other people's emotional states.
Yeah.
That's how we read. Our body experiences to some extent what the other person is experiencing, and that's how we know what they're experiencing.
Right.
So carers, of course, are going to be picking up a lot on the distress, for example, of the person that's the survivor. But carers have got their own issues as well in keeping healthy.
They do. Carers need to keep themselves well, because they play such a critical role in their loved one getting better. And if you don't look after yourself first, then you're not doing your loved one any favors by not looking after yourself first. So you need to make sure that you get respite, that you get time that is just you time, where you can actually look after yourself. Get a pamper package, go to the beach, read, watch TV, go on a holiday yourself, really, and also see a psychologist or somebody to support you, because it's a really tough role being a carer. It is a very tough role, but it is a very important role. And I cannot overemphasize how important that is, because, there was a recent review in Queensland they were trying to look at what people with disability, what were the predictive factors that would allow somebody to do well. So they looked at all these different things. They looked at demographics, they looked at different medications, they looked at different living situations, yada, yada, yada. The only thing that they found in this particular study of people with a disability that predicted whether or not they would do well was the presence of a mother. So if they had a mother, then that was a very good prognostic sign. That was the best prognostic sign that you could have, that you would do well, because then you had somebody that actually cared, and that is really important.
So it's been scientifically proven that mothers are good.
Mothers are good. It's been scientifically proven. Mothers are good. That's right.
I think we knew that anyway.
Well, but we've come a long way, because, when I was growing up, we had the refrigerator mother. That was considered the cause of autism. We also had a very damaging term to my whole profession, the schizophrenic mother, So mothers have been blamed for so many things. So easy to blame them, isn't it? But the bottom line is they actually do good things, and they're actually good for us.
Well, can we thank Harry for that segment?